Hello, I'm Dr. Samantha with Walk the Natural Path. Today's video is on Letrozole and Clomid and how it impacts your body, because I feel like people are just handed out Letrozole and Clomid all of the time without actually knowing what it does. So let's get into it. I'll keep it really simple. Don't worry, I'm not going to dive into like the complicated biochemistry behind it all, but I still think it's important for you to understand what's going on with your body when you're taking those medications. So what do? Essentially, they help people ovulate, which can be a great thing, right? Absolutely, 100%. We love that, especially for people who do struggle with ovulation. For example, those with PCOS or anovulatory cycles. Personally, from a naturopathic standpoint, I'd rather treat the root cause and get you ovulating on your own, but it is something that you can do to kind of quicken the process along, right? As well as timing your cycle. So if you do want to do a timed like IUI or just a medicated cycle, it can be really helpful to actually get the precise timing down, because you're dictating your cycle or ovulation with an actual medication, which for some practitioners and dealing with like booking appointment times and things like that, it can be more convenient. So anyway, Letrozole, Clomid, two medications. They do work in slightly different ways. However, just the basic is they help you ovulate. However, what they don't tell you about is there can be a lot of side effects. Those are going to differ for everyone, but a main one that tends to be pretty across the board is lowering estrogen. So yay, Clomid, Letrozole help us ovulate, but what does lowering estrogen have to do with it, and what does that mean? If your estrogen is lowered, that means you may not have developed a nice, thick endometrium lining for implantation to occur. So yay, we're having ovulation. However, our environment for implantation isn't exactly as ideal as it once was. If we're ovulating, that can be a great thing. That can help our progesterone levels increase and all of that. However, it can lower your estrogen. Even those who have elevated estrogen or high estrogen, it can show to completely tank or decrease those estrogen levels. So it's something to look out for. A lot of times when people work with me, I actually put them on a specific supplement regimen that help keep those estrogen levels where they need to be and help keep that uterine lining nice and plush and ready for implantation to occur. So if that's something you want to do, you can always, like I said, work with me, find another practitioner, but it's kind of a nice thing where you can kind of combine both natural medicine plus the conventional medicine. Other side effects tend to be a little bit more sporadic, and everyone is so different. So some people feel side effects on Letrozole instead of Clomid, or Clomid instead of Letrozole. Some people don't feel any side effects at all from either one. Congrats to you. Some people tend to feel moody, they get crampy, they get headaches. It can throw off their cycle and the next following few cycles. It can just do a lot of different things that honestly we don't really know until you get on the medication. So this isn't a video to scare you, it's just kind of educate you, because I feel like a lot of times practitioners are just like, take these medications, we're going to go through this process, and they don't really tell you what's truly going on or what could go on, right? They're not telling you that it lowers your estrogen and might impede, implantation, or that it could mess up your cycle down the road or cause headaches or mood irregularities. And so I'm here to share that with you. Just like birth control, right? I feel like birth control has a time and a place, and it can be really helpful for some people or very necessary, but we have to be educated on what can truly go on while we're using those medications. I've already said this, I feel like, a couple times, but this isn't a video that's saying I hate Letrozole and Clomid and they shouldn't exist. I think they can be really amazing and really helpful in many fertility cases. This is just some of my experience. Now, what I was actually talking about was the female side of things. I will tell you, I do have some males on Clomid to help increase testosterone and sperm count. I haven't seen a whole lot of side effects when it comes to the male side of things in Clomid. Sometimes, taking Clomid can actually cause the opposite effect that we desire in males. So sometimes we're going for increasing testosterone, but we see it all of a sudden decrease testosterone. But those things I honestly don't know a ton about. This is just some stuff that I've seen in practice. So what I was talking about before, mostly females, and then when it comes to the male side, haven't seen a ton of side effects, but sometimes I do see that opposite reaction. Ultimately, just ask your physicians about these medications, get the information, just inquire, ask for potential side effects, ask what it's doing to your body, ask about, why you're actually on it. Some people ovulate totally fine and then they're put on Letrozole or Clomid, and I just kind of wonder why. Like, what's the point for them? Why are they needing to go on that medication, or why do you need that medication, right? So ask those hard questions. Sometimes the practitioner will literally be like, I don't know what else to do. This is the next step that I know of. If that's the case, I really strongly encourage you to say thank you for being honest with me, but then go find a natural practitioner or someone who knows what they're doing and can do something different to help you through that part of your journey, rather than just throw something at you and hopefully it sticks. This video is going to be a shorter one because at the end of the day, like I said, I'm not going to get too technical. If some of you do want more of a technical video, please just let me know in the comments. Sometimes I feel like maybe I go too simplistic, but I really just try to make this simple and easy to understand. But I do know that there's always those people who really enjoy all of the details and like to understand it at a biochemical level. So just let me know. Ultimately though, I think that you have to make the decision for you. Just make it an informed one. Ask those hard questions. Ask the why, ask the how, ask, the side effects. Just educate yourself. That is your practitioner's job, but I believe that if you ask those questions, hopefully they will receive that well and help you through and allow you to make an educated decision. Like I said, those medications are mainly used in the female population to help ovulation occur. I do think that there is a better way to do that naturally if that is something that you're struggling with. However, I totally understand if you want to kind of hurry up the timeline, Clomid and Letrozole could be a really great option for that. On the other side, for males, it can be a really good option to actually increase testosterone or sperm count. Usually those kind of go hand in hand. Again, we can treat those things naturally, and I would love to help you and your partner on this journey. However, like I said, we can really meet you where you're at. A lot of times people are actually on, the medications, either males and females or both, and they do come to see me. We also work together to push them towards, natural conception, but they're also just wanting to do the conventional methods on the side. And we can do a little combination of both. And like I said, at the end of the day, your way is the best way. So whatever feels right to you is awesome. Just ask those questions and watch videos like this to help educate yourself. Again, thanks for being here. This video was short and sweet, and I hope you learned something. Don't forget to hit the subscribe button and turn on those notifications. Please give this video a thumbs up if you liked it, and have a beautiful rest of your day.